When you have a PhD in justice law and criminology, are an ordained elder, and have a challenging health journey, those become passion and fuel to advocate for health equity.
A lot of times people don't understand that when you have a mic in front of you or when somebody asks to hear your opinion, it's not about you. You're speaking on behalf of other folks that don't have that opportunity. So you don't ever want to squander that opportunity.
That's healthcare consultant, community activist, and servant leader, Dr. Patrick G. I'm Monica Fox, Vice President of Government Relations and External Affairs for the National Kidney Foundation of Illinois, and your host for this edition of The Journey Continues. This time, I'm excited to talk to Patrick about his journey and how his career exemplifies the intersection of faith, perseverance, scholarship, and compassionate action. Thank you, Dr. G, for joining me today and spending a little time with me.
Well, thank you for having me.
So please share with me how your kidney journey began.
My journey began in 2003 when I was a corrections captain / institutional training officer / field commander for Sussex 1 and Sussex 2 State Prison in Virginia. I was also working part-time in a juvenile correctional forum. So I had a number of Scared Straight programs trying to help kids not come visit me in the adult system. My average day was about 20 hours long. I would just come home late at night, eat breakfast, lunch, and dinner, and 9 times out of 10, pass out on my couch. So one day I went to work and I was feeling really sluggish, really tired, just couldn't focus. And I went to the sick bay and I was talking to a nurse about it. So the nurse asked me, had I ever had my glucose checked? I didn't know what she was talking about. So then she brought up the word diabetes and I was like, well, I heard it on TV. I don't know what you're talking about. In my neighborhood, we called it sugar. So I don't know anything about that. So she did a finger stick and she looked at me and then she walked off and she came back with her supervisor and she asked me for my car keys. I'm like, why you need my car keys? And she was like, your glucose level is 748.
Wow.
She said, I'm talking to a dead man right now. You just don't know it. If you get in your car and try to drive because you're on state property, we can call the state police and have you charged with driving under the influence. And I'm like, how you going to charge me with driving under the influence? I don't have any alcohol, drugs in my system. Because my glucose level was up, we can charge you. So I had to get an officer to take me to the emergency room. The doctor did blood work, checked my A1C. My A1C was 11.7 out of 12. So the doctor was like, hey, we're going to just deem you as type 2 diabetic. And if you don't do anything about this immediately, you probably aren't going to make it through the end of the year. So I was referred to an endocrinologist, and the endocrinologist put me on 2 forms of insulin, a fast-acting insulin that I would take with each meal, and a slow-forming insulin that I would just take early in the morning, and a pill medication. And she was like, Patrick, you need to lose weight, take your medication. That was it. For 10 years, up into April 2013, that's all I heard. Went to my doctor every quarter, did labs. This one particular time, April 2013, I go in for my routine checkup. And she was like, all right, Patrick, I'll see you in the next quarter. Fine. I walk out the door, walk into my car, open the car door, and I have my right leg in, and I hear somebody calling my name. Patrick, stop. I'm like, hey, doc, what's up? Oh, I forgot to tell you that you're at stage 3B of end-stage renal disease, and you only have between 30 to 35% kidney function. So I'm standing there. None of this I understand. Not one time in the 10 years that she was treating me that she told me that diabetes was the number 1 leading cause of kidney disease. We never had any discussion on that, never received any health literacy information, nothing. So now I'm standing there, I'm mad and I'm confused. And she just left me there. She didn't say, hey, Patrick, do you want to talk to a therapist? Do you want me to talk to you and your family? I was just left standing at my car in a state of confusion. I didn't know, how to go home and break this news to my wife, Tina, my kids. So that was a real lonely drive going home. 2 weeks later, I get a call and I have an appointment with a nephrologist. And my nephrologist said, Patrick, you're going to eventually go on dialysis. But how you can slow down the progression is to abstain from nuts, dairy products, and chocolate. So from April 2013 to November 2013, I went from 210 pounds to about 165 pounds, just blowing up. So now I'm so heavy, I cannot lay down comfortably and breathe. I can't talk. My speech, it was like I was hyperventilating. Now outgrown all my clothes. And I'll never forget this. In November, going to my nephrologist's office, I have on a white t-shirt, black sweatpants, stretched, a pair of socks, flip-flops, and that's it. And it was cold. Didn't even have a coat. And I walked into his office and Tina had to do the talking for me. And she was like, Doc, when are you going to start my husband on dialysis? I don't know if he's going to live or die. He can't sleep. He's restless. He's irritable. So the doctor made a call. And at that time, I decided to do peritoneal dialysis. So he made a call to schedule me for surgery. And I did the surgery having a peritoneal catheter placed in my underbelly. And after about 2 weeks of recovering, I did my very first exchange of peritoneal dialysis, December the 1st, 2013. Stayed on peritoneal dialysis almost 4 months, but in between that time, I had a couple of things to happen that led me to do in-center hemodialysis. One was they thought I had peritonitis because my fluid bag was really cloudy. And they had me on like 5 different antibiotics and it wouldn't clear up. So now I'm admitted to the hospital. And after 5 days of going through this antibody regimen and I'm in excruciating pain, they decided to send me into surgery to remove my catheter. I'm out of surgery. I'm recovering from the surgery, but I'm still in pain. And I have all these physicians that are asking me what's wrong. And I'm like, you tell me, you're the doctor. It took an intern 7 days later to find out that my gallbladder exploded. So now I have to go back in for another surgery. So I stayed in the hospital another 5 days after that. So it was a total of 12 days that I stayed in the hospital. So for 90 days, I had to do in-center peritoneal dialysis. And that was really an experience. But eventually I healed from that. Went and had another surgery to place the catheter on a different side and started back doing peritoneal dialysis. Another interesting thing was in March of 2017, while on Capitol Hill with NKF at a kidney summit, I was in the late Congressman Donald McKeechan's office and sitting there 20 minutes, everything was good. I went to stand up, I turned the corner, we walk out to the receptionist area, I shake his hand, and I collapse. I just pass out in the floor. So of course, I'm embarrassed. I tried to play it off. We go back in his office, I'm sitting there, he's giving me a bottle of water. He's like, hey, Patrick, you good? I said, yeah, man, I'm good. Thank you, Congressman. Turn right back around, boom, pass out again. So for all of those that hear this, you never want to do that on Capitol Hill because it literally takes an act of Congress to get off of Capitol Hill. They rushed me to the medical kiosk building where they had nurses there, called in paramedics, and I was feeling fine, but they wanted to send me to the hospital, and I just wanted to go back to the hotel room. So when I called my dialysis center and told them, they was like, well, Patrick, just see if you can go back to the hotel room, rest, and then drive back to Richmond, but don't go home, just drive straight to the dialysis center. So as I go into my dialysis center, my nurse is looking at me, shaking her head. I said, look, I know you're going to fuss, but can you at least hear me out before you fuss? And she was like, no, I'm not going to fuss. I'm going to apologize. And I was like, why are you apologizing? And she was like, well, nobody told you that you were suffering from hypercalcemia. And I'm like, look, can you dumb this down some? Because I don't know what you're talking about. And she said, yeah, let me simplify it. She said, your calcium level is through the roof, and that's probably what caused you to faint. She said, but also something more disturbing is it puts you at risk of having lung and or bone cancer, which could attribute to you having sarcoidosis. So I don't know what sarcoidosis was at that time, and I'm sitting there with lung and bone cancer, and I'm like, girl, kidney disease ain't no joke. All of these different diagnoses and all these things hitting me at one time, and I'm like, wow, this is crazy. So they referred me to a rheumatologist. So now we're in the month of August 2017. I go and see the rheumatologist. The rheumatologist was like, well, Patrick, we could do blood work, but there's no cure for sarcoidosis, but what you really need is a transplant. This was April the 20th, 2017 at about 3:45 p.m. I get home, I tell my family what happened, and I hook up later that evening to do my dialysis treatment. At 11:45 p.m., I get a call from the transplant center, and they said, Patrick, we have a match for you. They said, Patrick, do you want it? Yeah, I'm going to take it. Well, finish dialyzing, take yourself off at 3:30 and be at the hospital at 4:30. So I got there 4:30 in the morning, met my care team, went in, got my transplant. Then the journey went left because now, even though I have what I prayed for, and that was a transplant, when I woke up, the surgeon told me that I was dealing with delayed graft function. What is that? Oh, well, Mr. G, that means, in other words, you got a sleepy kidney and your kidney hasn't functioned because, your creatinine level is through the roof. So what you're going to have to do is you're going to have to do 24 hours of dialysis every other day bedside. So 5 days after my transplant, I'm told that I have a blood clot in my neck. I have to have another surgery. 3 days after the blood clot surgery, I am now hemorrhaging. Have to have another surgery. 17 days later, they decided that I needed to have something called a laparoscopic peritoneum window created inside of me so that I can drain internally. Now, Monica, mind you, I'm in complete stage 5. I hadn't urinated for 2.5 years. So the concept of me draining internally and I'm not urinating, it was just mind-boggling. So after 4 surgeries, 33 days in the hospital, I was transferred to a rehab facility to do occupational and physical rehab. So I come home and I now got this machine on me that sounds like a whole group of frogs just making noise. And on the 47th day, 1 small drop of urine hit the toilet water. Monica, I fell in the floor. I started crying like a baby. You know how it is when you teach your kids and grandkids how to potty, and you know how you celebrate?
Yes.
I'm celebrating with myself. I'm in the floor. Tina comes running in there. At that moment, it reminded me of the things that we take for granted.
Yes.
And it was at that moment when I'm laid out on the floor, it was like something came over me and I was anointed in that moment to ensure that I help people not to go through what I went through. Ever since then, ministry started on the toilet with one drop of urine. And I've been rolling ever since. Haven't had any problems with my kidneys, thank God. But that is my journey in a nutshell.
And that's quite a journey. So I wonder, what impact has that journey had on your wife and your family?
Well, I wouldn't be here. And I'm a speak as if Tina is speaking. So Tina works for the federal government, and I did not think she was going to stay for that long. You know, I expected her, she has to drive 2 hours, well, more than 2 hours one way to go to work. So I didn't think she was going to stay, but she stayed the entire time that I was in the hospital as well as the rehab facility. She journaled every minute that I was going through this. She took excellent, copious notes, even to the point that the nurses would come back at the end of their shift and be like, Miss G, what time did I come in? What medications did I give your husband? Oh, okay. Thank you. It was interesting. And it literally saved me because, Monica, I'm told up. I am on morphine, fentanyl, Oxycontin, and Dilaudid. I don't know who I am going through this because I was in that much pain. And she vetted every person that came through there. It didn't make a difference if it was a doctor, a nurse, CNA, food service, janitorial, patient advocate. Hey, who are you people? What school did you go to? Do you have a copy? And I'm not exaggerating. At first, I'm laying in the bed like, really? But then after a while, the longer I stayed, I said, oh no. Yeah. What about them, Tina? What can you tell me? So she would tell you, I wouldn't have made it. I mean, there were times, she would go home, get more clothes and stuff like that, but she never stayed more than 2 hours at the most away. And I'll never forget when the nurses would come in. Mr. G, you ready for your bath? I'm his wife. I got it. So this one time, I'm like, I'm feeling guilty. I said, look, Tina, you've done everything. I said, this particular time, I'm feeling some strength. Even though my kidney isn't working, even though I can't walk, I said, I'm going to bathe myself. Man, Monica, Tina threw the rag at me. She sat in the chair. And I'm sitting there like, what's wrong? You're doing my job. My bad. I'm thinking I need to relieve her because she ain't even sleeping during the night because every nurse that came through, she was on it.
Well, suffice it to say, she's an awesome caregiver.
I wouldn't have made it without her. So, yeah.
You have founded your own organization where your title is Chief Executive Hope Dealer at iAdvocate, Inc. What are some of the most significant barriers to healthcare that you've encountered, and how's your organization working to dismantle them?
My health organization is a faith-based health and wellness organization where I take and merge faith and health literacy into meeting people where they are. We're really boots on the ground. If you can't come to us, we'll come to you. And a lot of the barriers that we face, there are times where we're not seen and we're not heard, and we're sitting right in front of folks talking to them. There are a number of times that we get the invitation to the table, but we don't have no say at the table. We're just a check mark token spot, because they needed a patient, or they may need a Black patient, or they may need a patient that suffers with chronic kidney disease and diabetes. And to be able to share our experiences can be really hard at times. But then when you get the opportunity to maybe do closing remarks, that's when the impact comes. You know, if you've been sitting there for a whole hour and a half and hadn't had anything to say, and they're like, oh, hey, Pat, you got something you want to say? Yeah. And then you just say what's on your heart and make sure that people understand that I'm not just sitting here for me. It's never about me. You know, it's about Miss Barney, my neighbor across the street who suffers with kidney disease. It's about Mr. Johnson, who I remember shared the same chair beside me when I was doing in-center hemodialysis. A lot of times people don't understand that when you have a mic in front of you or when somebody asks to hear your opinion, it's not about you. You're speaking on behalf of other folks that don't have that opportunity. So you don't ever want to squander that opportunity. So I've had more doors slammed and bolted, and I've had construction workers to build center blocks in front of those doors to make sure that I'm not allowed to come in, than doors that were open, invitations that were granted. I look at that as a blessing. It used to deter me, but it just showed me that maybe that wasn't the door that the Lord wanted me to go through. So yeah, this work isn't for the faint of heart. It's not glamorous. People may see you here, there, everywhere, and they see a social media posts, but they don't see the blood, sweat, and tears behind that post. They don't see the frustration. They don't see me balled up on the floor in frustration or me laying prostrate in the floor before the Lord asking, why me? Just like Paul talked about in the New Testament about that thorn, I can relate to what he's talking about because my kidney disease is my thorn. But as much bad things and as many disparities that are currently out there, there's no stop until I'm 6 feet under.
So, how can faith communities contribute to the mission of improving health equity? And what role do you see them playing in your future initiatives?
Faith health ministries have been the hallmark of the community, and it was really prevalent during COVID-19, where a lot of Black and brown communities really didn't trust the information that was coming out. And especially when you think about the kidney community, because of our conditions, what happened, a compromised immune system, nobody was really talking to us, even though the first two people to die in Seattle were kidney patients. So because of that, a lot of churches stepped up. And of course, industry, pharmaceutical companies, clinical researchers, the light bulb went off. And they finally wanted to engage with faith-based organizations. So the church is doing what it's supposed to do, even though it could do better. A lot of pastors fail to realize that God created physicians for a reason. I mean, even when you look in the New Testament, Luke was a physician. But for some reason, a lot of pastors would tell their members, oh, you got this, just pray it off. And that's good. But while we're still waiting on the Lord, we still need to go to a physician. You still may want to understand about what it is that you have. And this is where faith and health literacy works hand in hand. Not only does it build trust, but you're also able to talk about some of the medical injustices that have happened to Black and brown people through scripture. And that's able to break down the barriers so that the church now becomes a credible messenger. If I can share this as a prime example, Enon Tabernacle Baptist Church, and I know Reverend Miles is probably going to get mad, but I got to tell him, this church is one of the only churches I know in the United States that in an emergency situation can flip the church to become a medical kiosk to where they actually have certification for electronic health records. Every time they hold a health fair, every time they treat folks, all of those treatments along with a summary goes into each one of the congregants' health records. Now, the church does consist of a number of physicians, nurses, pharmaceutical reps, clinical researchers, stuff like that. So it's a huge congregation, probably up to 15,000 people. But when they do community outreach in the city of Philadelphia, it is prevalent. And thank God that Reverend Miles works with a number of kidney organizations, the National Kidney Foundation of Philadelphia, NephCure International, the American Kidney Fund. So they certainly understand what's going on in the community. And when they hold events like kidney screening or prostate checks and stuff like that, they're not doing one or two people. They are doing the entire community, including unhoused people, those that may be in need of food. He's reaching the masses. This is what church is supposed to do. In the words of Jesus, when Jesus said that he didn't come to talk to those that were well, he came to talk to those that were sick. So when we view the church as a hospital, and we take those that may be suffering and broken and afflicted there, the church is supposed to respond in kind. Now, like I said before, a number of pharmaceutical companies love to engage with church communities, but they certainly understand that the leader, the under shepherd of the church, is going to protect their flock. And they let them know, if you come in here and lie, if you come in here just trying to do what's known as helicopter research, we just want the data, we don't want to be a part of your community, that's not going to happen. There are a number of institutions out here like Heal Collaborative, which is based in Atlanta, Georgia, that goes in and they are mediators between the church and medical organizations trying to partner together. You also have the National Black Church Initiative, which is based in Washington, D.C. They have 150,000 churches and I believe 3.27 million members. If you go on their website, this is all that you see, research. And they are also ones to be able to safeguard it, and they will go before Congress fighting against this. So the church is doing what it's supposed to do. We just need to get the medical community, pharmaceuticals, research companies to be able to go there and want to engage with the church.
I agree with you that the faith communities are extremely important in this battle. And so finally, what message would you like to leave our listeners with about health advocacy and health equity?
There's a lot of layers to advocacy. So I'm on this journey now to kind of go from patient advocate to lived experience expert. I found out that a lot of folks would try to diminish your voice. A lot of folks want to tell your story because they believe that they can tell your story better than you. I would recommend that people stand 10 toes down because nobody can tell your story like you. Advocacy starts when you go in, no matter if it's what they call the doc in the box or you go into a clinic, hospital, or whatever, and you start having a communication with that doctor. If that doctor does not see you and he's standing right in front of you or she's standing right in front of you, then there's something that has also been taught, and that's to use the phrase, I need a reset. And then at that time, I would request for folks to say, hey, I need you to talk to me using healing language. That means that I'm not a patient anymore. I'm a consumer. I need you to treat me with the respect, dignity, and honor that I'm treating you with. I'm afraid. I don't know what's going on with me. I understand that you don't have that much time to talk to me, but I need you to be able to answer my questions. That's advocacy, because if you can't advocate for yourself, you certainly won't have the capacity to advocate for anybody else. And everybody should want to, regardless of race, gender, ethnicity, sexual orientation, whatever, everybody should be fighting for equity and making things equitable for everybody. This is why I'm really pushing from going from patient-centric to human-centric. We need to see the whole person. We need to know that this person that you're talking to has feelings. You, as an advocate, have feelings. I need to be heard. I'm not here trying to waste your time. And once you start doing that and putting principles behind it, you'll notice that the barriers will break down. Your medical providers now know who you are, what to expect, and then they'll become more open. And then you, in return, get to make decisions about your health care management. You get to tell the doctor, look, I want this med, but not that one. Can you give me information on this? Look, I need a second opinion. You do this for you. There are a number of folks that are afraid to speak up because they fear the doctor's going to retaliate against them and things like that. Then find a family member or a friend that can be your care partner in that moment, or your caregiver, and let them speak for you.
Yes, that's great advice. Thank you so much for your wise words and for spending this time with me today.
Thank you for having me.
Dr. G is a faithful, compassionate advocate for the underserved population. His work is making a difference all over the country. For more information about dialysis, kidney transplants, and opportunities to advocate, visit nkfi.org. I'm Monica Fox, a kidney warrior, and this is The Journey Continues. Prevention is a key part of our mission at the Kidney Foundation. That's why at the end of each episode, we share a health tip.
Here's today's health and prevention tip. For most people, having one or two occasional drinks won't have any serious effects on the kidneys, but excessive drinking certainly will. If you're regularly drinking past the point of moderation, you may be causing slow, long-term damage to your kidneys that can't be repaired. Heavy drinking can cause the kidneys to work hard, weakening their filtering ability and disrupting their ability to balance fluids and electrolytes, leading to dehydration. More than 4 drinks in one day is considered excessive by the Centers for Disease Control and Prevention. One drink includes a 12-ounce beer, a 5-ounce glass of wine, or a 1.5-ounce shot of liquor like whiskey, vodka, or tequila. Moderation is key. Always consult your healthcare provider to determine what's safe for you based on your body size and your medications.